Hi everyone, I'm Dr. Chan Janbon, consultant ophthalmologist and refractive surgeon from the International Specialist Eye Center, Kuala Lumpur, ISAC KL. Thank you for joining us today, and thank you for inviting me to give this talk. I'll be speaking on my early Envista SimplifEYE experience. This is my financial disclosure. So the Envista SimplifEYE, is this another monofocal lens or is it something special? I will first speak on my previous Envista lens experience. To be honest, there are a few problems with it. It opens very, very slow, and it is not a preloaded lens, hence it is actually soaked in a solution. And we have to do a blind grasp to actually take the lens out. And this gives a chance of scratching the lens. I'll demonstrate what I mean by showing you this video. This is how the correct way of actually doing it. Hold the lens at the edge of the lens between the haptic-optic junction, and then insert this into the cartridge. And this is actually the correct way. And here we have the accidental way, which most of us may actually have this problem, where we actually hold the lens as a whole, including the optic area, which may have a accidental scratch then, and just insert the lens into the cartridge. And by doing so, sometimes the lens may not be loaded properly and comes out inappropriately. So why do I actually choose the new Envista SimplifEYE lens? Well, that's because they really listen to the users and they make some changes to the lens. And here we have two videos. On top, this is the Envista SimplifEYE lens, and below is the old Envista lens. This is a head-to-head comparison. On top, as you can see that the lens below, the lens is already in the eye and it opens up real slow. And on top, although I inject it slower, however, the lens already opened within about 20 to 30 seconds. But this old Envista lens actually does not open until about 1 minute plus. So what they do is actually they just change the material, and this lens actually open up at least 200 times faster compared to the original. So I'm just going to fast forward to about 1 minute, 40 seconds and still not open yet. And here we have the second reason why I like to use the Envista lens is because it tolerates decentration really well. And this is by having a neutral aspheric design, which allow a consistent power from the center of the lens up to the edge of the lens. This means that the power will remain as 21 diopter, let's say, from one end to the other end. And it's also aberration-free optic design, and it does not induce other aberrations in case of decentration. And I have a case here to actually depict this. I have a patient who is a 30-year-old Indian lady. She has history of a right eye traumatic cataract, which was done about 5 years ago. And she came for a general checkup. She has no complaints actually. Her vision is actually 615 without 8 and 69 with 8. This is a refractive error. And as you can see that the lens is actually pretty much decentered, but the patient has no visual complaints. So the decision is really just to leave it and to only take it out if it is necessary. The next point that why I'm using the Envista lens is that there's a unique design with balance of depth of field and image quality. This means that this monofocal lens has a chance to actually read. To explain this graph, in an average cornea, there is a spherical aberration of 0.27 in the cornea. And the Envista lens is actually a neutral spherical aberration lens. This means that it retains some of the spherical aberration in the eye. How does it convert this into a useful data? So the stride ratio actually is the measure of image quality. 1.0 means the image quality is really good. And of course, it reduces with a reducing number. And in the Envista lens, it retains some spherical aberration, giving some amount of depth of field to the patient. So in other lenses, most of them are negative spherical aberration, and hence it neutralizes the spherical aberration, giving no depth of field to the patient, but it increases the image quality of the patient. And this Envista lens actually gives a good balance between the depth of field and the image quality. To explain spherical aberration, in a perfect lens without any spherical aberration, the image quality is really good as there's only one focal point. However, in a lens with some amount of spherical aberration, the image quality is not as clear. However, it gives an area of depth of focus and hence giving a reading ability to the patient. So these are the numerical value for all the lenses that's available in the market. The IQ lens has about minus 0.2 spherical aberration, and the Technis has minus 0.28. Although the image quality produced will be very clear, however, there's no depth of focus in these lenses, and hence it's really just for far vision. There is no option for a reading ability for this patient. And for the Envista lens, actually the spherical aberration is 0, giving some amount of depth of focus for the patient. And the CT Lucia 621 actually gives a negative spherical aberration in the center and a positive spherical aberration at the periphery. And this one here, it's a video of my patient 1 week post-op, and she has some ability to read up to about N4 vision or N5 vision.
This one.
Read.
This one.
Yes.
0175761312. 145725247485. Varifocal lens gives fast adaptation period to reading ability. 4401.
Go straight to this one, the English one, and the
Allow yourself time to appreciate all of its advantages.
next line.
This one. If you could read this line, you're doing very well.
Okay, last one.
Congratulations. You can read the smallest them of all.
So next, this lens is actually now preloaded, and this is to show how this is my first case of actually loading a lens into the patient's eye, because there's no touching of the lens, hence there's no chance of actually scratching the lens, and it will also avoid injection loading of variability, and it avoids potential loading error and also reduces the operating time. So all you got to do is just load the cartridge into the injector, put in some viscoelastic, and push the lens in. This is my first time loading the lens, and it's quite smoothly. I have no complaints about it. So next is about the lens stability. I often use this lens for complicated cases. That's because the lens is actually really stable. The Envista lens has 31% greater capsular back contact compared to the Technis lens, and 25% greater capsular back contact compared to the Acrisoft lens. And it has a greater than 300 radial compression force than the traditional hydrophobic acrylate lenses. So in this graphic here, this is to show that the lens has a 110 capsular back contact compared to the Acrisoft IQ and the Technis lens, which has less capsular back contact. So this video is to show how stable the lens is. I prefer to use the Envista lens in a complicated case for a reason. This is a case I did about 2 years ago. It's an Indonesian lady. And this is done before the pandemic. She has an anteriorly subluxated cataract, and there's about 4 clock hours of zonular dehiscence. Notice that the lens is actually not very stable. So when I'm doing the CCC, the lens is actually still moving quite a lot. And especially when I'm doing just a grooving, the lens is already moving towards me. So I have to put in some iris hooks to actually stabilize the lens. And finally, after phaco, to put in a capsular tension ring. And after removing all the remaining cortical matter, I put in the Envista lens. And this patient actually came back just about a few weeks ago from Indonesia. And she is still doing very well. Vision is really good. I think it's about 6/9. She still needs to wear spectacles for the reason of having astigmatism. As you can see, the case was done pretty well. And next is that the lens is actually glistening free lens compared to the other competitor lens. So I did a small little data collection of my own, and it's done in the year of 2021, a non-comparative case series. So there are about 44 eyes which I've implanted with the Envista SimplifEYE lens. And out of these 44 eyes, 17 eyes actually has a pre-existing mobility. It's about 38.6%. There are 2 cases of pseudo-X glaucoma, 2 cases of open-angle glaucoma, and 2 cases of acute angle closure attack, 2 cases of retinoschisis, 5 cases of retinal scars, maculopathy, and then there's 3 cases of subluxated lens and 1 case of corneal scar. So these are the demographic data of the patient, mostly female, and they are about 60 to 70 years old, mostly Chinese. So as you can see, out of these 44 eyes, the axial length ranges from very short eyes to very long eye. I basically panned the whole range of IOL that is available from 0 to 27. So this is the pre and post visual acuity of the patients in 1 month. So this is the post-op visual acuity of all the patients. There are 44 eyes from beginning, but however, there are some that is lost to follow up. So only 33 eyes were there finally. Most of the patient has a 20/20 vision. Some has still some residual visual loss, and that's because of the morbidity that the patient has. So this is another reason why I use the Envista lens, because it has a very good refractive predictability. As you can see, most of my case, the mean refractive spherical equivalent is about -0.2. So in conclusion, this Envista SimplifEYE lens is a very predictable lens, where it opens very fast and is less sensitive to decentration. And it preserves some amount of depth of field for the patient despite having a clear vision. And it is actually a preloaded lens, which is then scratch-proof and avoiding some lens loading area that we may encounter every now and then. And it's a very stable lens. It is glistening free and has a predictable outcome. Thank you very much for your attention.